Hey everyone. Occasionally there are times we have these patients that really capture your heart and imagination with their case because really have nowhere else to go with their diagnosis, and sometimes they've been through multiple specialists and multiple surgeries already. This is one of those patients. I mean, he's only 2 years older than I, and he was only given the choice of a below knee amputation. Now, being about 42 years old, you can only imagine what that can do to a person. So this is a quick review of his case. Basically, has osteomyelitis of the talus, chronic osteomyelitis, and basically they were keeping him on crutches, feeding him antibiotics. That went on for about a year or so until finally he found me. Somebody referred him to our office for care. Surprising that it took that long, but bear with me. We'll go through this case. After 6 to 8 weeks, this cadaveric talus was placed in along with internal fixation and an IM rod. This was done with an addition of external fixation on top of this in order to salvage the limb. Remember, the guy was facing amputation. This is the attempted mortise view of the same guy. We're talking about a year now out. Really no pain. He's able to walk with the AFO. Again, this is the talus. As you can see, the talus and calcaneus are coming into view better. And we're talking, the IM rod is still in place. The talus is not as dark as it used to be. Gives a good sign of revascularization of the talus, between the talus and the calcaneus. There is some hope. This patient does not have any pain. Now let's go on to the patient interview. You'll be surprised. A little bit further along, this guy weight bears, as you can see, again, luckily the calcaneus is holding up. The talus is still holding up. No crushed deformity. And IM rod still in place. Everything is good. Patient has been able to weight bear with the use of a cam boot without other assistive device. Here's the final fixation with the external fixator taken off. This is the IM rod with the fixation in the talus navicular joint. The remainder of the talus was taken out. Remember, this is a cadaveric talus. At this point, we're seeing the darkness of the talus hopefully getting revascularized, but rigid internal fixation was achieved utilizing plate screws and IM rod. Here you see the first surgery by me, which is number 4 for the patient himself. Took out the body of the talus. Those are antibiotic beads that you see in there, and a nice Elizarov circular fixation to maintain the length, or else we're going to have problems with the length later on. This was placed in for about 6 to 8 weeks. It's a case of a 42-year-old guy with osteomyelitis of talus. This is how he presents to me: completely collapsed talus, confirmed osteomyelitis, went through HBO therapy, intravenous antibiotics, multiple surgeries to try to salvage his ankle. Unfortunately, none were effective. There's him on another view. Again, chronic pain, unable to bear weight on this ankle. The only solution was a below knee amputation. The man right here had osteomyelitis of the talus.
Yeah.
It was after an auto accident, am I correct?
Yep.
Yeah.
And then you came to me for a second opinion because you had a big hole here that was draining.
Yeah, horrible.
You were, yes, there was 3 surgeries done prior to you, but nobody did
What you did.
what you did with the fusing, the talus, the cadaver bone,
You said you could do it.
stem cell, or
And you said, hang in there.
you said
with you.
do it my way or not anyway, and
Yeah.
it's gonna be a year and a
Yeah.
half process.
Whether you like it or not.
No, you're doing really good. I mean, this actually looks like a foot. You can't tell that you had a previous infection, and this hole has not opened up. Am I correct? Since we finished our
No,
surgery.
it's actually coming up. Like there was a really big indent.
Yes.
I have a picture of how big the hole was
Awesome. Awesome.
originally. I mean, it was.
And this is the wire site for the Elizarov frame, the big frame we have in you, and then you have a rod that was put up through the bottom to stabilize with everything. You actually had cadaver talus. So we put a whole cadaver talus, we drilled it, put some stem cells on there, put some of your own cells. So stem cell took it out of your tibia and put it into there, so mix it in. So it looks like it's incorporating very well. The bone is not collapsed whatsoever. It looks like the talus almost look like yours, actually, on the X-ray. And your pain before the surgery was how much would you say?
It was high.
12. That was 12.
Well, I mean, it was like, I mean, like a good 8, 9.
8, 9. Okay.
I mean, there's times where,
And how's it now? You're wearing AFO. You getting about life and everything else.
Yep.
Moving around.
I'm still doing physical therapy, which is working out great.
Awesome.
What, I mean, 2 months. I think I've been doing that.
Okay, good.
And working out great. Yeah.
Well, you're able to use that leg again. I'm very
walking.
proud of you.
Yeah,
I'm
this
very
thing is
proud of
helping me learn, because I can't. But
He's walking with it.
I can walk without like a limp or anything.
Excellent.
I'm working on that.
you. Excellent. No, that's awesome.
Yeah.
I'm very proud of you. I think you've done really well. You've been to 3 surgeries before me. This is the 4th surgery.
Yeah.
What was mine. So I'm very glad. We did put antibiotic beads in there.
You put
Correct.
yeah.
We put antibiotic. We threw
That's
a
what-
lot. Yeah.
That was a kicker.
I remember the talus was very. It was not very good smelling when we took it out. That the talus was really infected. So I'm very glad you had the result that you did. I think you're gonna continue to do better. I'm
Yeah,
very
because-
happy with it.
That's what kept happening. It kept getting infected 6 months, a year after surgery, and I mean,
Nobody ever thought,
We're-
never ever got to that.
You know,
Because all we kept getting presented with was amputation.
You know.
yeah, that was the
You were the only
kicker.
one.
It was like I was starting to look into amputation.
You know.
And then-
How did you find us anyway?
I was living out in Phoenix. I came here,
Bob
and
Dompkin.
a good
Oh, yeah.
friend of my mother's,
Okay. A good friend. Okay.
Yeah.
Yes.
And
Yes.
he's come to you a couple times.
Yes.
and so
Right. Well, I'm
I hit
very
the
happy.
jackpot.
No, I'm very happy. There's plenty of patients like yourself out there that has a hard time finding us or whatever. So we're trying to figure out a way out
You've
to
done
prevent
great.
some amputations and hopefully have more success stories like yourself. You're a young guy.
Yeah,
So we can't afford you-
Please, no.
we need
not
a-
yet.
Yeah,
A young guy like yourself with an amputation doesn't look very good.
Yeah.
So
No, I know. I mean, that's
He was
really.
fighting it. He was, got
yeah.
to you. in
Well,
the end.
I'm glad you did. I'm glad you did.
Yeah.
I'm very glad we had this.
I'm glad I found you.
I had a chance to
You
get
know,
it
I
done.
rave about you.
Well,
And-
thank you.
And Patel, Dr. Patel.
Yeah, Dr. Patel works
Everybody
for me.
talked to him.
Yeah. We took
You
him
guys
on.
did,
He
yeah.
he trained
Yeah.
with us and we took him on. So that's
Yeah.
awesome.
Yeah.
Is he still doing good with you guys?
Oh, he's doing awesome.
Good.
He's at our north office seeing our patients up there for
Yeah.
us. So he's learned our tricks now. So
Oh, he's learned all the tricks.
he's learned all the tricks. He's off on his own.
You don't want to show
He's
too
flying
much,
his own
man.
rig.
You gotta keep your,
Get the edge
right?
going.
You gotta.
Yeah, that's good.
No, you're awesome. You guys have been so great to me, and I really appreciate it. And
And because it was a long, hard battle to get to you. I mean, it was miserable.
Well,
And it was.
but once we found you, yeah,
It was-
it's been awesome.
awesome.
Yeah.
Cool.
Very good.
Well, I really appreciate you guys. You guys doing really well. Continue as you are. Continue AFL. See you back in 6 months. Okay.
Yeah.
We'll be here.
Yeah.
Okay.
Kill
No,
it.
thank you for everything. I really
Thank you.
appreciate it.